How are seniors and their caregivers protecting themselves and coping with the current surge of the COVID-19 pandemic? We are having a conversation today about what's been done to protect this vulnerable population. Director McCoy Wade, back in April, citing state health department data, the Sacramento Bee said that at least 40% of the COVID-19 deaths in California are from elder care homes. What have we learned since the beginning of the pandemic that's been used to improve the safety and health of the aged that are in elder care facilities in California?
Thank you, and thank you so much for highlighting this terrible, terrible aspect of this pandemic. Absolutely. Any setting where you have a lot of people living together is going to be at higher risk of spread. And then you have folks who are older and at a higher risk for the most serious consequences of this terrible disease. And so you kind of, I hate to say it, but you have almost a perfect storm. And this has been true across the country. And what has been happening is the operators, the staff, the residents, the family have all, and the state, absolutely the state, have been working kind of back to basics on infection control, on the necessary equipment, the necessary practices, the necessary staffing ratios and staffing support so that workers can be safe as well. It really is a total 360 effort. I think that the challenge in all the work that's been done since April to make it safer from a public health perspective, we're starting to see the real other effect of the isolation of people being locked down, in a sense, if you will, to be kept safe from infection, the concerns about what that means for their connectivity and their relationships and their movement. So I'm really interested to our panel today to hear how they're balancing these really challenging issues at this time.
And Todd, you run a long-time provider of care to seniors. What's been the experience in your facility since the onset of the pandemic?
Well, since the onset of the pandemic months ago, we immediately tasked our head clinical person and our COO to spend 100% of their time on it. And they immediately put into effect all the recommendations from CDC, Department of Public Health. Subsequently, some licensing recommendations came down. But right away, a lot of the infection control practices that we all practice as a matter of due course with more urgency. So we were early on with masks, disinfecting surfaces, daily temperature checks, social distancing, frequent washing of hands. Consequently, we've had, apart from the numbers that were quoted at the outset, we've had far fewer incidents of COVID and fatalities in our communities, which are mostly in the Sacramento County area, but spread across varying locations in Northern California.
And incidentally, how many facilities does Eschaton have?
We have over 30 locations of varying types, from affordable housing in Sacramento County and rural areas. Most of our skilled nursing centers and assisted living are in Sacramento County, Nevada County, Placer County, El Dorado County.
Right. Sergio, as the pandemic has continued to live with us over these several months, have the issues coming to the Ombudsman program evolved or changed, or is there a different emphasis than has been historically?
Yeah, so my team usually goes out in the field to advocate for residents' rights. So since the pandemic, we've been doing everything through the phone or through Zoom to continue to advocate for our residents' rights. So it is a completely different change for us, something that we're not really used to. So we had to adapt to a new way of continuing to provide our services to our residents in long-term care facilities, nursing homes, assisted living facilities, memory care facilities, boarding care homes, and adult residential facilities. So it has been a complete change for the way we carry out our duties and our services.
Right. Jeannie, Leading Age has been involved in essentially spreading the word about some of the facts that many of us are unaware of about the size and scope of the aging population in California, and how some of our assumptions about our aging community are not necessarily reflecting of the reality. How does this affect how seniors are looking at just going about their daily lives that's different from, as a matter of fact, just say the beginning of last year or the end of last year?
Well, Scott, thanks again also for having me participate today. And this has been one of the huge impacts. We represent over 120,000 residents living in senior affordable housing, living in life plan communities, assisted living, skilled nursing, and being cared for by home and community-based service providers. And in that context, some of our members have talked significantly, and Kim and Todd know clearly about this in your roles, about social isolation. And I think one of the biggest impacts of this disease has been isolating older adults in their home settings, even if they're still independent, and even more difficult for those who have compromised physical or mental health issues. So many of our members have taken great strides in trying to improve and decrease and reduce social isolation. Some of those have used electronic means like this, encouraging Zoom and FaceTime and other electronic video conferencing techniques. Others are implementing some other sort of cuddly devices where individuals can have a pet that's actually electronic to help warm their circumstances. And others have created internal communities, sort of their own internal pods, so that they can get together. One of our members, a resident of one of our members, was telling me recently that they are actually having cribbage games every day. They've been in the same pod for the last 5 months. And so they're able to socialize with a smaller group, but at least interact every day. It's a huge, huge problem. And the Department of Aging is responding incredibly well to try to figure out with us, and we partnered very closely with them as well as the other departments to figure out how can we bridge this enormous gap.
Todd, when Jeannie talks about social isolation, I think about, for instance, in my own case, my mother's birthday was last Monday, and I have not physically seen her in the facility that she's in since March, other than through a window or through a glass. And so at the home she's in, they were kind enough to roll her out, and we looked at each other through the glass and talked on the telephone. But I'm curious, how are your residents coping with this issue? How are they doing?
Well, certainly safety and social isolation are the two things that come up. I think I shared with you that I myself experienced some of that. I have a mother that lives in one of our Eschaton assisted living communities, and I've not seen her for over 4.5 months. But I talk to her on the phone frequently. We do a lot of what you've heard. What's really amazing is the resilience and adaptability of our older adults. Many of them are on Zoom, various forms of social media that they might have found quite intimidating before COVID. So we're really trying to support a lot of those efforts within our communities to get them connected to family. We're certainly doing outdoor visits. We're also using a lot of our outdoor spaces in our buildings that have that, and it's a secure area. Residents themselves are engaging in a lot of things like hallway bingo, in some of the independent properties, maybe virtual cocktail hours. So we're really sensitive to the issue of social isolation. I think what is most frustrating for everyone 4.5 months in now more is the visitation restrictions. It can be very difficult to explain to families that we're trying to balance infection control recommendations, in some case licensing requirements, with safety, trying to keep people engaged. But it's very frustrating for family members who would go visit mother, father, grandparent, multiple times a week in many instances, not being able to have that physical time with them. And even in the outdoor visiting, that is far more cautious than we would care under ideal circumstances, still wearing masks, social distancing, but at least it's trying to create a connection. So we're trying to do lots of activities, lots of social media, trying to encourage residents to get out of their rooms, still participate. No communal dining or anything like that yet, unless it's in very small groups that can keep distance. But we acknowledge, like everybody else does, that it certainly becomes more and more frustrating the longer this goes on. But safety has to be at the forefront.
Of course, of course. Sergio, I'm curious, your program and the agency that it's housed within, what are either seniors or their loved ones bringing to you most right now? Where do they need the most help?
Right now, it's definitely staffing is one of the most common areas of help. With COVID, most staff members, work in 2 different facilities, which, they also have to make a living and all that. But with stopping visitation, our biggest concern is what Kim and Janine have talked about, is isolation. For example, we have particular residents who will not eat unless they have their loved one there to help them assist them to eat. So a lot of the most common complaints we are receiving is, when can I see my mother? When can I see my father? What else can we do besides the window or bringing them out? Now, a lot of facilities within my counties, they've done a great job of accommodating some families, us doing the window visits and outside visits, 6 feet distancing and all that good stuff. But it's not the same when you don't have that human interaction, being able to hug your loved one and reminding them that they're there. And especially for us ombudsmen, as I stated earlier, we're not going into facilities. We haven't been in facilities in the past 4 months. However, we are in phase 1 of re-entering facilities, where we're allowed to enter a facility once every day. And right now I'm working on that with my team, so we can start making our presence again, to remind our residents that we're also here for them, to advocate for their rights, and also work in facilities who might not have tablets or resources to at least have that Zoom virtual communication with their loved ones outside. So, yeah.
Kim, I'm curious, the department, along with a number of other stakeholders, has been working on a master plan for aging in California. How is this virus and its long-term implications going to affect some of the policy issues that you and other leaders like Jeannie are looking at, as to how aging California not only will live, but will be taken care of in the future?
That's exactly the question that's top of mind. A year ago, the governor called us together to put together a master plan for aging in California, a 10-year plan, recognizing that right now about a quarter of the state, about 20% of the state is older than 60. We're going to 25%. We're getting more diverse in every way, in our race, in our income, in our family structure, how long we work, our health status. So are we ready? And we knew before COVID that we were not. And tragically, with COVID, so many of the weak spots in our readiness to age as families and communities in a state have just been underlined in so many difficult ways. So absolutely, the plan's going to be informed by that. 3 areas that really jump out. One is what we're talking about right now with residential living. How can we make residential living that wonderful place for community and support, but also are there smaller units that need to be created so it's more pod-like and less large facilities because of infection control? Can we make those jobs full-time, 1 facility jobs, rather than have this risk both for the worker and the resident? So there'll be a lot of, I think, innovative thinking led by the people on this conversation about residential facilities. But that's really, 90% plus of us as we age are going to be aging in our communities at home. So how do we do that and thrive? What is the type of housing we have? What's life like when we stop driving? Where do we find our meaning and purpose? And so we're not pushed aside from our communities, and how do we fully included? How do we afford those extra years? These are, I think, the questions of how we all live at home and thrive into our 90s and beyond is the top of mind. And then I would be remiss if I didn't raise a 3rd issue, which has come up in so many cross-cutting policy issues, which is really ageism. And how the stereotypes we have about age, our assumptions about age, and how we all carry them with negative associations, and it leads to bad policy, it leads to bad programming. in so many ways. And so I think we just had a virtual town hall on ageism attended by hundreds of people. We just ran an online survey asking people about their COVID experiences, and nearly a quarter said that ageism was part of their experience, being treated differently and negatively because of their age. So I think a renewed look at ageism, maybe a new look for some of us, as we're looking at racism and other inequity, is really the moment demands it of us.
Jeannie, I'd like to get you in on this as well. What do you see, if we're trying to look at the pandemic as not only a challenge, but an opportunity, what's the opportunity for a conversation that has not happened yet or hasn't been as robust as it should be about how we deal with the issues of aging and the fact that this population is just going to continue to grow?
Well, I'm going to leap right from something that Kim said, and that is about ageism, because our national partner, Leading Age, has as its vision, and established this vision 3 years ago, an America freed of ageism. And I think one of the big silver linings in this pandemic is highlighting how older adults live, not just in California, but around the country. Myriad issues of equity, which Kim alluded to, by the diversity of the population and the growing diversity of our community. And also, I think, how we need to focus on housing, care, and services for older adults and the related workforce. Workforce is critical. And I think as we consider the movement forward in this master plan for aging that we are very immersed in today, literally, we're in the final stages of some of our recommendations right now. And I think it's critical that we continue to mobilize everyone around the state to understand the needs of older adults and also of the workforce and how we train, how we staff, and how we elevate these individuals who are so dedicated to working in the field of services, housing, care for older adults, but also how they enter the field. So beginning at kindergarten, beginning in elementary school, continuing through high school, and changing the language that we use around older adults at every stage of our development. That's going to have a big impact over time. Also, I think the issues that we've raised and highlighted through the types of services, the types of housing structure, the types of activities that go on and are related to older adults will be changing and will also be impacted by COVID-19 and by our insights that we're learning in just a very short period of time. I mean, think about the headlines almost every day address older adults, address senior living in housing communities, and have exposed, unfortunately, the raw problems that some of these organizations have. But we're able, I think, to surround them with new activities, with new benefits, with new insights to improve that housing, care, and service delivery over the course of the next 10 years with the Master Plan for Aging, but immediately with these small incremental changes that we're making now.
Todd, I want to come back to you and the family of facilities that make up Eschaton. I'm thinking about the fact that you and your team, you're all first responders in being the primary caregivers for the residents that are within your facilities. What is it that we as the public need to appreciate about the work that you and your people are doing every day, and how it's impacting your own safety and ability to go about your own lives, both professionally, but also when you return to the community?
Well, I'm glad you asked that question. We have a total workforce nearing 2,500, and they are the ones that provide, most of that number are the ones that provide the services out in our communities. And they've been coming to work every day. So they've, exposed themselves to that risk. Furthermore, they're very aware that they need to practice safe, safety precautions when they're in their own time with their own families at home. So I think there are certain negative stereotypes about senior living communities and skilled nursing. But just like the people in the acute care field, they've been coming to work every day, 24/7, providing wonderful care. When there is, the occasional COVID, either from an employee, other people cover for them while they're isolated, or residents, they still come to work. And by and large, they don't get the recognition they're due, I believe. But the dedication has been astounding. The commitment to the residents and the sensitivity to the residents' needs around staying connected, engaged, not getting depressed, trying to connect with family, all while this goes on and on and on. Everybody, was more hopeful when we started reopening in June, and then to have the resurgence, and then more of a hunker and down mentality again. Just the constancy of it. So, as an organization, we just want to pledge to them we'll do everything we can to support.
And incidentally, Todd, how does the lack of rapid testing affect your ability and your colleagues throughout the industry to control the virus spread in your facilities?
Well, we've had very nominal virus spread, but certainly rapid testing would be very helpful. We take somebody out of the work environment the second they're symptomatic and they're off. And in the case of skilled nursing, for example, there's was a mandatory testing, and there's everybody's once a month surveillance tested. So we've actually found a number of asymptomatic people which have to be removed from the workforce. My big concern is the safety of our workforce. And keeping them healthy. And the challenge we're facing right now is with the restarting of schools. I think as an employer, we're going to have to be very flexible to try to shift people around between PMs and day shift, weekends, if somebody can only work 6 hours. They're not only getting the demands of coming to work and caring for the elderly, they're also under tremendous demand at home, particularly those that have families. So we're just trying to do whatever we can as an employer to support that workforce.
Right. Kim, I'm curious, are there any conversations going on at the state level, not only within the state itself, but in the broader stakeholder community relating to these issues about the pandemic and the tensions it's causing between generations, the young who sometimes are portrayed as either fatalistic or invincible, and their parents and grandparents who are more susceptible to the virus and its complications, and how we as a society are negotiating that debate?
I've actually seen an evolution of that since when we're in COVID time, so everything is going so quickly and yet so slowly at the same time. But when this began, you really did hear young people this, older people that, kind of different, and some of that's grounded in medical risk, health risk. But I think as we've progressed, and Todd hit on it with school reopening, we are in this together as families, as communities, as workforces. We are all juggling, whether you're caring for a child or caring for a parent, whether you are working in one of these places or your partner is. We really need these entire approaches. That's why the administration, Governor Newsom, has said the Central Valley, we need to be working on the essential workforce and congregate care and young people social gatherings. All of this comes together to manage and the spread. So I really do think we're moving towards that whole family, whole community approach. And I think the other pivot that Todd hit on, we really do need to, we kind of were in this initial sprint of hunker down and redesign services and put everything on Zoom and add more behavioral health support. Like we've got a friendship line, mental health hotline for 24/7 call. But I think we're at a pivot point of this is going to be a marathon. And I think back to World War II efforts and people really thinking about the home front and finding purpose in victory gardens and other types of service and being away from loved ones and having fear and anxiety for, and I just wonder if we can learn something from our elders about previous times, about finding purpose and meaning. I mean, nothing breaks my heart more than hearing from older adults who don't know who are conscious that they have few years left and are very worried about the quality of those few years. And will they be able to see their grandchildren or volunteer or be at their church, their home of worship. And so how do we find meaning and purpose and a higher call in this time, as it may stretch out months and years together?
Could I add one interesting perspective to what Kim just said? You know, one of the things that has been most heartwarming to me is to see, you talk older and younger, by and large, our workforce is much younger than our older adult population, and in many instances, the age of grandchildren or great-grandchildren even. You would be amazed at the comfort our older adults are providing to the younger workforce. They're saying, listen, we've been around 90 years. We've been through wars. We've been through depressions. We've been through any number of things. We're going to get through this. So they're actually, in a sense, often providing comfort to the caregivers. And I just think that's a wonderful story about perspective of what time will teach us.
And that is a great place to leave it. Thank you all, and best wishes in your continued work. And that's our show. Thanks to our guests, and thanks to you for watching Studio Sacramento. I'm Scott Syphax. See you next time right here on KVIE. All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org/video.